Healthcare in America is changing, and one local medical practice is pioneering a new way to pay for healthcare services. Isbicki Family Medicine is Erie's first insurance-free primary care medical practice known as Direct Primary Care. As a direct primary care practice, they operate on a monthly membership, providing unlimited access to your private physician without worrying about paying co-payments, co-insurances, or deductibles. DCP practices are growing nationwide to respond to needs for healthcare reform at the primary care level. Our newsmaker tonight, Dr. John Isbicki of Isbicki Family Medicine, joining us now with much more on this pioneering step. Dr. Isbicki, thank you for coming in. We appreciate it tonight.
Sean, thanks for having me.
Why did you choose to go this path, the direct primary care path?
A large part is the response to healthcare reform in the future and the evolving needs in the community for relationship-centered healthcare.
All right, now we talked about there being a membership involved. Or what are the benefits to belonging to a DPC practice?
Well, in a DPC practice, you get unlimited healthcare and access to your doctor 24 hours a day, 7 days a week, 365 days a year. Unlimited care for $65 a month. We will be able to provide wholesale medications to our patients, wholesale lab testing at wholesale prices. It's just really a cost-effective way for patients to save money and to get quality care where the patient-doctor relationship is paramount.
How does a patient join up, and how does that whole relationship work?
Patients can go to our website and join there. They can call our office. They can also go to our Facebook company page, which we've had just a tremendous outpouring of a positive response to this model of care. Patients are excited. We're excited. We're entering into a new era in medicine where patients and doctors can work together in a collaborative for the greater good.
Let me ask you quickly about that. When it was first suggested, when you guys said, let's go this path, what kind of reaction did you get? Did people immediately say, yeah, I get it, or was there a kind of a learning curve here?
I think initially patients in our practice have kind of gotten used to a type of model where we give patients time. They spend more time with us in the rooms being examined and answering all their questions versus sitting out in the waiting room. A lot of the hospital-owned practices, unfortunately, just are high volume, and the doctors just don't have the time to spend with the patient answering all their questions and providing that thorough care that patients are looking for. So our patients, when we announced this to them, they were very excited. Some are nervous. We understand there's a lot of uncertainty in healthcare today, and we're trying to provide certainty with sound medical care in Erie, Pennsylvania.
Let's talk about if you go beyond the primary care needs and you need lab work or you need a specialist. How does that work?
Nothing really changes as far as referral to specialists. Patients still can see the specialist. If they don't have insurance, it's always an obstacle, but the folks that do have insurance still can see the specialist. As far as labs go, labs will be, through our office, will be provided at wholesale prices. We'll be able to save patients a substantial amount of money, which will offset the cost of the membership.
How much, before we let you go, has the Affordable Care Act played into all of this? Because this is a significant departure, I think, from what a lot of people are used to.
I agree. I think that the Affordable Care Act is presenting new challenges to patients and doctors across the country, and we've been researching the direct primary care model, and it seems to make sense. This is a solution for primary care to make it affordable and to give quality care.
Now, Doctor, we said that Isbicki Family Medicine is the first in the area. Would you expect to see some folks following your path as the months and years go on here?
Absolutely. We've been taking a lot of direction under Dr. Josh Umber at Atlas MD and Dr. Serbin at Pinnacle Pediatrics of Pittsburgh. These are direct primary care practices that are pioneering in their areas in this new model of healthcare, which just seems to make sense for patients and for doctors.
Yeah, and as we said, it's been getting a lot of national attention. You guys are the first to bring it to Erie. We appreciate your time. Thank you for coming in tonight, Dr. John Isbicki.
Thanks for having us.